Yes, you were saying how you'd prefer not to have side effects, which I prefer for you as a participant as well, because you come back tomorrow and you don't want to be able to concentrate. So if we're saying minus 30, then how about even if we could get it to minus 15 today?
2 hours.
That's it, John. That's when I've got it. Sorry. That's what I test as your initial. So we get our before photo. Now, the next step is to figure out the worst level to treat. Commonly, it's right here, between C2 and C7. Out of all the levels in his neck, which one is reactive the most? Now, what am I saying? So I'm just going to do a little gentle mobe. I'm just doing a sort of a upslope mobe. I'm just doing an upslope at the moment. And then, whoa, 5, 6. So far is the worst one. 4, 5, 2, 3, 4, 2, 3. Up here, 1, 2. And then 0, 1's kind of a bit, tricky to get into. But oh no, that's gliding okay. Good, got it. 5, 6, John. We start with your limbs short of any, aggravation, and we're going to do lateral flexion. Lateral glide away, correct? Can you see how I sort of give John confidence with my manual handling? How do I get my hand under his neck comfortably? See how I push my hand into the pillow and into the bed to allow his head to come over onto it? And then if I need to move the pillow, I definitely sort of add a bit of gentle traction as I lift the neck, so I'm not doing some shear force. I'm going to create some space so there's good ability for my hand to get under there. And any time I put my rest, my hand is pushing down, not lifting him up. Anytime you're holding someone's head up, you're creating uncomfortable, unconfident feelings. So if you're not doing anything, hand down. Now I need this hand to get under there. Everyone tell me, what am I grabbing? What am I doing with this hand? C5, yep, for C5, 6, that's right. I'm going to get a lumbrical grip, lock everything above, and do a lateral glide away. How big will the movement be, probably?
1 minute.
Yeah, really, really tiny to start with. Now, how do I get my hand under there? Well, if John can say this is comfortable, this is what I think will be comfortable for you, John. I am going to roll this way to give space. My hand will go under, my arm gets under, and then I roll him back on. I grab onto C5, rest the head down, and of course then this lock comes on top. Then I ask John to give me feedback. This shoulder lock on the top of your forehead, John, should be just mild pressure without any discomfort. Correct. Thank you. If it becomes uncomfortable at all, you speak up. What else can I say? The forearm should be directly behind the skull. And if you can't do that exactly, we will work on variations. But if at all possible, have the head balanced. Like, if it goes that way or that way, it'll just teeter off. It's that balance. That's why I'm supporting you here. Now, what am I doing? I'm getting a lumbrical grip and I'm gliding that way, correct? Probably 1 millimeter or less. Let's see. Get that C5, got it. Lumbrical grip, got it. My legs are gliding my trunk. You ready? I'll give you those side effects. You ready? The sound effects are good. That's it. Everyone got it? John, you got it? Not lifting up as I go.
Your right hand doing anything?
My right hand is kind of just checking that I'm getting a very subtle mobe that way. And maybe a little bit of assistance, maybe a little bit of checking the reactivity of the upper traps. And how do I become confident that I'm not doing something aggravating? Well, at least as best as I can. Yes, that's right, just sense R1. What did you sense while I was doing that?
So gentle.
Please, make sure everyone hears that and remembers that's what it should be. There. So no change on that one yet. So I did enough to get a change. So I now have to just think about changing something. Don't repeat exactly the same, otherwise there should have been some difference. So I'll just try a different level. And I was mentioning to you the ones that were a problem close by, 5, 6. So I'll try 6, 7 first as a different level. can already feel that's different, John, because when I come to there now, oh, about there. Okay, can anyone see there's more range on that one? Okay. So it is 6-7 that's better. What's my logic saying though? 6-7's better, that's good. What do you think I should do next? That's an option, but there's something else that might help me more. Yeah. What if 7-1 gets me even more? Just do this little logic thing. Always ask yourself, what could I do to even get better result? Now, I'm not allowed to get too much good result on you. Let's measure how far we go. But I'll talk you through what to do. Go to 7-1. 7-1 might give you half the improvement. So what does it tell you? 6-7 was the best. But, you know, think like this, because this is the way to get the most rapid results. It's much more efficient to trial different things to work out what works best than it is just to persist with something you think is the good one. Now, John, I'm just going to check to see if I'm doing too much improvement for you in one go. Because, you know, we had, you know, positive here, and then I'm just going to go down and see where the positive is again. Look, that's 50% improvement. That should be enough for today, for this session. And if you're going to react negatively to that, and people will tell me usually within 2 hours, I can feel headache kicking in, you know, any of those sorts of symptoms, then we'll know we've done plenty on you. If we can get to later this afternoon, and you can say, look, there's no problem at all with me, I think you're not getting any side effects. We could always finish it off today, or you know what I mean? So keep thinking like that. Interface, what do we really mean? We are talking about the actual foramen, the opening between the vertebrae that allows a nerve root to exit the spine. So we've got a joint, or we've got two different vertebral levels, one above the other, and we've got a space that allows a root to exit. We're going to be focusing our treatments on this type of proximal structures to release and treat neural dynamics. What are we aiming for? We know we're on the right track when we get immediate improvements. Immediate improvements, if you add them up, typically we clear NDT within 15 minutes. Sometimes some people are saying they clear NDT within 30 minutes of treatment, but 15 is a typical average when I survey physiotherapists. Now, neural interface treatment is very different to a standard joint glide. Neural interface treatment doesn't go into resistance. It's very gentle, there's no provocation. So the client must speak up if they are to experience any symptoms. And that indicates to us that we may have missed R1. We had a limb in the body that was positive NDT, and for example, in this example, I'm going to say it's the upper limb, and we were going to use a cervical lateral glide to free that up. Now, what's a cervical lateral glide? If I can show you on the model first, then we'll do it in real life. So what I'm doing is saying, work out which is the most hypo level. It may be C5, 6, for example, in this case. We're going to use a lumbrical grip. We're going to use that lumbrical grip to grab C5, 6. So the C5 vertebrae, the level above. We're going to use a lumbrical grip to grip the, to make sure there's a nice, firm, even pressure throughout from C5, and we're going to block everything above that. If you can see my handling here, my handling is to say grab onto C5, grip it, and we're going to block everything above it, and I will demonstrate to you that a lateral glide is a pure accessory movement to do a lateral movement of C5 on C6. The reason why it's not a joint mob is like a normal mobs is because we go from neutral to resistance and back to neutral again. If you can imagine, resistance sometimes might kick in with less than 0.5 millimeter of movement in this amplitude initially. I'll demonstrate all this for you. The first thing that I figure out is which level is most hypo, most restrictive, has most of the dysfunction in it. So the first level, what I do is I just then do PIVMs, very gentle, quickly up and down the cervical spine, and I discover, yes, it's C5, 6 that's the most hypo level. We make sure that there's no reactivity so that Reese is in a position. You can change the pillow position, change the bed up and head of the bed up and down. You're in a position that is short of R1, so you have no reactivity in your body, Reese. So make sure we've got short of reactivity to begin with. The next thing I'm going to do then is describe, and if you could can you see a view of this? I'm doing that grip with my hands that I just demonstrated to you on the spinal model. And I'm doing that sort of lumbrical grip with my web space here at the back of the spinous process of C5. I'm going to grip like this and grab C5 vertebrae. I've now got my hand under the C5 vertebrae and I'm gripping like that, and I can feel my knuckles of my fingers sort of gripping against, gripping C5 transverse processes and the arches of C5. I'm now resting Reese's head on my forearm. Are you able to see that my forearm is under here? Can I just show you? Yeah, there you go. Thanks, Reese. That's my forearm. And Reese's head rests on my forearm. My forearm rests heavy down in the bed so that Reese's head is not being lifted, because it's quite uncomfortable to have your neck and your head lifted off a pillow. So I'm pushing down. That's it. I'm also next going to block C5 and every level above. The way to block C5 and every level above is to now gently pinch, and now I'm gently resting my shoulder tip down onto forehead of client, so that now I have a block. What I mean by a block is, and if I show you a lateral glide movement, then I am using my shoulder, my forearm, everything to block above the level of C5. The first approach I use is lateral glide away. So it's the left side, so I'm doing a lateral glide from the left to the right. So I block those levels. I'm only doing the glide to R1, remember. So as soon as there's some reaction of the muscles around the neck or some stiffness in C5-6, as soon as we hit that, we stop the mob and we go back to neutral. So it's from neutral, and I'll mob, so I'm now going to do a lateral glide where the C5 vertebrae is gliding to the right, and then a glide back. That could be less than a millimetre of movement the first repetition. So now we repeat and glide again. The glides are done slowly. Count 1 1000, 2 1000 to do the glide on, 1 1000, 2 1000 back to neutral. This is, I find, very awkward for physiotherapists that are used to doing mobilizations in grade 3 and 4 levels, because it's very gentle, exceedingly gentle. Now we repeat that, and typically after about, say, 5 to 10 slow repetitions, the amplitude will increase until the onset of R1, and we'll be able to do twice the range. Now that means we're getting somewhere, we're getting an improvement, because we're getting more amplitude before the reactivity kicks in. This is a pure transverse glide, and now, look, I'll give a demo now of us building up amplitude. I'm trying to use my finger to indicate what the direction that the C5 vertebrae is being glided in, and that is amplitude, and I'm back to neutral. Slowly, 0, 1, 2, out, 1, 2, back to neutral. Very, very gentle and slow. Now I'm moving the forehead, the nose, the chin. C5 all moves one. There's no rotation, there's no side flexion, there's no any other movement. It's a pure lateral glide. It's going to be an important part of success with the technique, is to make it a pure accessory movement with no other physiological movements sort of added into it. I'll give you a demo of what it looks like when you've really got a good amplitude. I'll see Reese's neck is pretty good and up for this. And if you could see how far I'm moving now, that far, and 1, 2, back. 1, 2, across, 1, 2, and back. Now that would be when someone's progressed a long way. Right. Once I've done some mobs, could even be 10, 15 reps, once I've done some mobs like that, whatever it is that increased the amplitude by a good amount, it's time to reassess that upper limb test that was positive previously and reassess. And when we're on a good track, what we expect is it will change and it improves its range, for example, by 10 or 20 or 30%. So we repeat that set and then retest again, and we keep repeating until the range continues to keep improving until the limb is clear, as in NDT is negative. Now sometimes you start to plateau. Sometimes you get 50 or 60 or 80% improvement in the test, but then each set you do doesn't really get you a lot more improvement. So now it's time to do something and progress the technique. Now progressing the technique is to preset the client's limb in the test position with one arm and to continue doing the lateral glide with the other arm. And I'm doing that now. And I can feel now R1 kicks in faster because we've preset the nervous system. So the sensitivity is greater. So now I have to do mobilizations to free up this C5-6 level again. So I'm not forcing the level to free up. What I'm saying is, as I do a neural interface glide, the sensitivity decreases, the reactivity decreases, and my amplitude is allowed to go further until R1, until the onset of R1. And then I can extend the arm out like this and do another set. So I'm now demonstrating what it would look like to do multiple sets over a 15-minute period. And when I come back up, and I would stand in the position that I can't stand in now, otherwise I'd block the camera, and I would retest neural dynamics, and there would be no protective guarding as a result of that.